Humans have evolved with Mycobacterium tuberculosis. Today, tuberculosis remains one of the most widespread and deadly infectious diseases in the world. In our country, the annual mortality to tuberculosis is extremely high. There are around 370,000 reported deaths of TB patients per year. It is almost like a train carrying 1,000 TB patients crashing daily with no survivors and never reported. This is the scenario even though it is not an untreatable disease, and theoretically, the first encounter with the disease is 100% curable. Why is TB then still such a serious health problem? We need to ponder as to why it is that in spite of such huge efforts by the state and others, not much has been achieved as far as controlling this disease is concerned. Why is it that the numbers of cases of multi-drug resistance and extensive drug resistance are on the rise? Is there something very seriously wrong with the management of the disease? Are the priorities for management of the disease improper or misplaced? To find these answers to the questions, we need to look at the complexities of the disease and its treatment very closely. There are several problems in the diagnosis of TB. The symptoms of the disease are not very different from common illnesses, and most diagnostic tests lack desired sensitivity. The problems related to the treatment of TB are even more serious. There is a standardized treatment regimen incorporating antibiotics for treating TB. In clinical situations, one of the main problems with these antibiotics is that they not only kill the mycobacterium but are highly toxic for the patient also. It is therefore an irony that the most unaddressed situations of TB treatment are linked to undernourished patients, and the majority of the TB patients fall in this category. These cases are from a hospital in central India. They show how tricky it is to treat undernourished TB patients. The so-called standardized treatment regimen often substantially enhances the suffering of patients. Almost in all such cases, the patients undergo a testing and arduous journey. The list is very, very long. When I write conclusive TB diagnosis for typical 25-year-old person who weighs less than 35 kgs, I get shivers. With no exaggeration, it is almost like writing a death sentence. The person may die of TB or of drugs also, and it gives us a formidable challenge to save his life. Most unfortunately, we face such challenges quite often. These factors make treating TB very complex. Researchers suggest different reasons for this. In typical Indian conditions, it is found that about 40% of patients leave the treatment due to the drug-related problems, that is toxicity and side effects. Other reasons are migration for livelihood, which lead to discontinuity in about 30% patients. About 20% discontinue the treatment due to relief from symptoms, and about 10% do so because of work-related reasons. The newer drugs for sensitive TB should be able to shorten the duration of treatment, should have longer stay in the body, should have longer half-life, should be able to move or diffuse quickly inside the tissue, and should be less toxic. Our primary concern should be to find better drugs to treat sensitive MTB. Also, the drugs alone cannot do it. We need a foolproof delivery system that is equipped to take into account the limitations of drugs and patients. In fact, drugs cannot be seen without the delivery system. Requirement is not just of new drugs. The attitude towards non-adherence and the defaulters has to change. It should be remembered that every patient wants to be cured. It is too simplistic to assume that non-adherence is just due to complexity of the treatment. After all, people consume food in a fairly complex manner, so there are more serious reasons for non-adherence. But this will happen only when the scientists are able to understand the problem in a broader and deeper sense, where they see mycobacterium along with the patients, and pharmaceutical companies start giving more importance to the suffering of the people than to their own benefit.